COVID-19 is creating more obstacles for the healthcare system. 2 Works for You's Tatiana Taylor explains what's causing state leaders to ask schools to step in to help.
The Oklahoma Blood Institute supplies about 90% of all blood for all Oklahoma hospitals, but the institute is facing a blood shortage because of the pandemic, so they still have to supply all of that blood, which means they'll need lots of donations every single day.
We're trying very hard to ensure that we continue to have blood drives.
1,200 donors a day, just to keep hospitals running across the state.
Since COVID-19, we've been dealing with, critical levels of blood, and we've been able to manage to stay with the usage. But as more hospitals come back online, more surgeries, the more there's a need for it.
Jan Laub with the Oklahoma Blood Institute says there are a lot of obstacles, but 2 stand out. The first, schools going online or closing altogether due to COVID-19.
30% of all of our blood that's provided to our Oklahoma residents in the hospitals in the need is provided by the education system. And as you know, it's been in the news, some are going back to school, some are not going back to school.
The second one, hospitals are getting more patients, more surgeries, and more appointments, COVID and non-COVID related. But there are ways to help. Even state leaders are stepping up to bridge the gap.
State Superintendent Joy Hoffmeister just did a press conference today urging all the education centers to continue to do blood drives because we are essential.
Schools, businesses, and churches host blood drives weekly, and they are sanitizing, social distancing, and wearing masks to keep donors safe.
Anybody that is healthy and 16 years or older can donate. If you're 16 or 17, you have to be 125 pounds. If you're 18 and older, you can be 110 or more.
If you'd like to help but don't know where to go, there is a link in this story on our website at kgrh.com where you can search a donation center near you. In Tulsa, I'm Tatiana Taylor, 2 Works for You.
Meanwhile,